Welcome everyone. Today, as part of our Make Difference Count campaign, we're talking to Laurie Hillsgen from Carewise New Zealand about a very exciting new project that's just been launched. And we're delighted to be able to have her today and to have her go through the program and let you know what it's about. So welcome, Laurie. Thanks for making the time.
Thank you, Carol. It's a pleasure to be able to be here to celebrate the launch of Carewise.
Great. So Laurie, maybe if you just start off by telling us a little bit about Carewise New Zealand.
Sure. Well, Carewise New Zealand is a national not-for-profit. I was one of the co-founders back when I was caring for my partner and juggling work and care. And it started with a few of us who were carers, and today our direct network is 50,000 individual carers and organizations. We're, New Zealand is a small country, so we work strategically in partnership with many other community and not-for-profit organizations, and also with business networks, because almost 90% of New Zealand's 490,000 plus carers are workforce age, and most of them do juggle work with caregiving. So we provide information, advice, and support to carers.
Great. And what are some of the milestones you've reached over the years of, what you've done with Carewise New Zealand and how it's impacted the community and employers?
Well, I guess so. When we first started Carers New Zealand, there literally wasn't even a brochure for New Zealand's carers. And I was quite shocked as a carer myself at the time that the focus was entirely on the person with a medical condition or who was in the health system. What did they need to get better or to live life? But behind the scenes, of course, there were lots of people providing care whose lives were also very impacted by health and disability and palliative care situations, whether they were evolving over time or, as happened with me, it happened overnight. I became a carer overnight and was completely ill-prepared for that.
Yeah, and how prevalent do you think this is in organizations? Obviously, you've mentioned 490,000 carers in New Zealand. How does it impact organizational life as such?
Well, we think that that is a census number. So the census asks, do you care for someone in your home or in another location? And that's how we get that number of 490,000 plus. That's the number from the latest census. It's a jump of about 70,000 from the previous census, but we think it's a very underreported number. So for employers and organizations, we all bring our lives to work with us. And that's a large number of New Zealanders who are caring, and it does impact your working life at times of trauma or if there's chaos with services or for whatever reason. But I think it's well understood in other countries, but I think in New Zealand, many employers probably don't realize that 1 in 8 of their staff, at least, have caring responsibilities. And that might be for a short time, it might be suddenly, or it might be a lifetime commitment because you've got someone who's got lifetime support needs. So you're working, contributing. This is at every layer of every workforce. The most senior people are carers, business owners are carers, right through to your front line of all the services that you deliver will be at the back of their minds if they're a carer, organizing lots of things as well as working.
Yeah, so juggling the caring responsibilities with full-time, very often full-time work commitments. So when you refer to carers, Laurie, what do you specifically mean by that term?
A carer, as we define it, is somebody who helps a friend or family member who's unwell, who's frail, or has a chronic condition or disability. They might have a terminal condition, and that person couldn't continue to live at home or in the community without that help.
And do you see the incidence of carers in organizations going up, as the population ages? Have you noticed a trend over the last number of years?
Or yes, because there are more carers, but also caring itself is more visible. I think we all are starting to realize with our aging population, more care is being delivered in the community at more complex levels than past generations. I mean, even a few decades ago, somebody with any kind of serious ongoing need would have been in a facility or institution. But these days, those caring responsibilities have devolved into the community. And I think that probably isn't very well understood across our whole social and business systems, that, quite complex levels of care for a long time are happening at home.
Mm.
So what does that mean?
Yeah. And what is the best response from employers to support people with caring responsibilities?
Well, this is an issue worldwide, so it's exciting to be working with you on the Carewise program. The simple things can often make a difference. Isn't that often the way? Uh, Thinking about cares. Who are they in your workplace? Do they what kinds of help could you as an employer give that would make the difference for that person to be able to keep working? It might be as simple as allowing them to make different kinds of support calls during working time and to make up that time later, or to attend medical appointments, to be able to work flexibly, which we certainly all understand a lot better through COVID-19. But it matters a lot to a carer to not have to hide their caring role, to feel like it's going to compromise their prospects or how colleagues view them, or how it might impact their promotional opportunities. That they can be open about it and they can say, look, with these things, that will make all the difference to me. Would you be able to provide that support? And to do that transparently together, so that, when the inevitable hiccups and crises do happen, you just work through that because you've discussed it and you've got a plan.
So it sounds to me like it's a bit about some practical steps that organizations can take, but also creating some psychological safety for employees to actually be transparent about their
And even
needs.
knowing that, often the things that you worry about never ever happen. So an employee might be thinking, well, gee, if this happens, then that means that's going to happen. And they'll worry about that a lot. Where if they talk to their employer, that's a what if, that may never happen, but you've got a relationship with your employer to handle that if it does. And then, which is the more usual situation, you get hit with a double whammy that you never see coming. Well, you'll deal with that too, because that is life after all. These things do happen. It's just you
Mm,
probably worry about them more because they've already had some whammies. Yeah, they worry about the what ifs.
yes, understandably. And so that brings us to a really exciting new initiative, which Diversitas is delighted to have been able to partner with you on, and that is Carewise. So I'd love you to tell us more about Carewise and the exciting launch this week.
Thank you, Carol. And I would like to give you and Diversitas, full credit for the partnership that we have, because you first came to Cares New Zealand with the idea for what became Carewise some time ago. You had seen the impacts employers were dealing with about aging and caring in the workplace. And you were looking at some of the global programs for working age carers that you wanted to talk to us about. And it's been quite the journey to get to this exciting phase of having Carewise ready to launch. It is a free nationwide program for employers. It provides information and tools to help any organization of any size be care friendly. It's through using some of the policy advice and templates and guidance and the resources that Cares New Zealand produces, so that you can be care friendly. I think quite easily. We've removed a lot of the barriers to helping organizations be care friendly. That's been part of the journey we've had, Carol. But uh, the program's development has been supported by the Ministry of Social Development. And one of the key objectives of Carewise is to keep carers working. Because at a time in New Zealand where we're having debates about raising the retirement age, like many other countries, the reality that we find in our helpline is that a lot of carers are falling out of work before the age of 65. So we're losing their skills because they're feeling they need to focus on caring because it gets hard, because they're worried about the what ifs and they leave work. So that has impacts for them and their family. It has impacts for employers who lose those staff, some of whom will be your most experienced, qualified, and valued staff. And it's also a macroeconomic issue because we do live in an aging society where if you have too many people leaving work to care, what does that mean for our economy? We really need to think about that now more than ever. So Carewise, we had anticipated COVID-19, of course, when we were preparing to launch Carewise, but as an employer, you can go to the website carewise.net.nz. You sign a commitment saying, yes, we want to be a care-friendly workplace. We welcome you with open arms. We give you all the tools and information you need to distribute to your staff and to help you understand who carers are and the steps that you can take to be a care-friendly workplace. And why should an employer care about that? Well, it is that big number. 1 in 8 at least of every workplace is a carer at any time. So for any employer to understand who they are, what they need, how to retain them, how to support them, that's just a sensible business goal for anyone, I would have thought.
Yeah, so it sounds to me like not only great advantages for carers inside of organizations to equip them to continue to work, but looking at a macro level, looking at empowering the New Zealand economy, which, let's face it, has taken a massive knock,
Yeah.
as you said, from COVID. So given that, I know COVID wasn't planned, and given that it all sort of coincided, uh, what kind of impact has that had on the Carewise program or your sort of future thinking around Carewise?
I think it probably just brings home its relevance. At crisis times, whether it's an individual family crisis or this is a national and global crisis, um, what support do people need to be able to keep working? And not just to be physically present at work, but to actually be able to focus at work and give their 190% at a time when that's really needed. What Carewise does for carers is it gives them the tools and information they need to have supports in place for anyone in their life who has been affected or just services disrupted or whatever through COVID-19. And to just make that seamless and as easy as possible so that when they're at work, they are very focused and feel they can keep working.
Yeah, great. And so the soft launch has happened this week, and people can go to your website to find out more information, or they can contact Diversitas if they would like to chat about it. What are some of the exciting developments that you see unfolding over the next wee while as momentum takes off for this great program?
Well, we're looking forward to really working alongside and getting to know the employers who join Carewise, because I think what I've learned so far with the employers that we've been working with is there is so much good that happens in different workplaces, but it probably gets buried in our silos of an individual workplace. And I think what I'm looking forward to is the creativity of people putting their things into a pot and sharing best practices, and out will pop even better tools than we have already for Carewise. We also are part of a global network of similar programs that have existed for some time, where there's a lot of other tools and information and savvy and knowledge that we're looking forward to sharing with employers here. And also, caring is such a hidden thing, although it's a big population. It's something that tends to get buried in our communities. And I've seen that in COVID-19 too. Considering carers are the country's biggest health workforce, it's fascinating to me that we just leave them to get on with it. So I'm looking forward to having some of the stories of all of this come out of workplaces, come from carers, so that we can share those and learn a lot, because we need carers more than ever. We need them to keep making the decision to care, because theirs is an important role on every level. It's a priceless social and family value, and it's worth at least $10 billion a year economically before you even get to the paid work that carers do. So we want them to keep making the choice to care, and we also want them to keep contributing, earning, and using the skills that they've developed, and supporting employers to be able to capture that. So they can do that individually by joining the Carewise program, but also I'm looking forward to the collectivity of what will happen with Carewise, with networks of employers.
Yeah, fantastic. So it sounds to me like caring is a collective experience, and organisations supporting carers, is a collective opportunity as well, sharing stories and sharing best practice. And sounds to me like that if we get momentum on this program, then New Zealand will be right up there,
Yes.
with the rest of the world in terms of our response.
We've had, not from employers, but we've had a few comments from carers saying, why would employers care about us now? They're struggling to survive. They're letting people go. They're wondering, where will the money come from to keep our organization going? And that is all very true. But I think, once again, some of any organization's most valued people do also happen to be carers. So to minimize further disruption at a time like this, we all need to look out for each other. It's not a nice to have. It actually is about um, business common sense and making use of the tools you have, including those skilled people.
Yeah, very, very good point. Well, thank you very much, Laurie, for your time. It's really exciting to be able to support you on this, and I feel very positively about the impact it's going to have on New Zealand employers and the carers who are trying to juggle their caring with their work responsibilities. So thanks for your time. We really wish you all the best with it. We will continue to support you, and we look forward to seeing what unfolds as we go forward.
Thank you. And we're looking forward to working with all of the employers that want to be care friendly. We're hoping for New Zealand as a whole will be a care friendly business culture. Thank you.
Thanks so much.
Bye.
Bye-bye.